Coming up on Legislative Review, a contentious debate in the House over increased Medicaid payments. Plus, increasing access to hormone therapy. You're watching Legislative Review. Welcome and thanks for watching Legislative Review. I'm Angela Nolasco. In the House, a contentious bill that could have a big impact on healthcare access for low-income patients in Washington state. House Bill 1392, concerning the Medicaid access program, attracted significant debate on the House floor Thursday. Medicaid, also known as Apple Health in Washington, provides medical services to low-income patients. Designed to improve Medicaid reimbursement rates for healthcare providers, the bill aims to increase the Medicaid payments they receive by bringing them up to the levels of Medicare or federal health insurance rates starting next year. Supporters claim that many healthcare providers aren't being paid enough for their services, which has resulted in fewer providers and less access to care. They argue that providers often lose money when they treat Medicaid patients because their reimbursement rates don't cover the full cost of care. This, they say, can lead to clinic closures, fewer pediatricians, and service reductions, especially in rural areas. To fund these increases, the bill introduces a new Covered Lives Assessment, which would require health insurers and Medicaid managed care organizations to pay an annual fee. According to the bill, the money raised would then go into a new Medicaid Access Program account to support increased payments to providers, so more doctors can accept Medicaid and provide access to care, especially for children and vulnerable populations. Democratic Representative Nicole Macri sponsored the bill.
Nearly 1 in 4 Washingtonians depends on Medicaid to meet their health care needs, and that is nearly 2 million people in our state, including half of all children and births that happen here in Washington. The Medicaid program pays less than most commercial insurance, and for some services does not come anywhere close to meeting the cost of that care. This bill will help to leverage over $400 million annually from the federal government in order to increase reimbursement rates for our Apple Health program.
The bill faces significant opposition from those who argue that these fees could drive up the cost of health insurance and hurt families by increasing premiums in individual and small group markets. They also claim it would put more strain on small businesses, making it harder for them to afford health coverage for their employees, and that while the bill focuses on broad reimbursement increases, it doesn't target the areas of most need, like rural communities or underserved areas. Some also argue that it will benefit ineligible individuals. Speaking to oppose the bill, Republican Representative Jim Walsh.
But one of the cost drivers on our policy around Medicaid, what we call Apple Care, is that we are by design making the benefit available to people who can't get it through the federal government's purse. And Mr. Speaker, that is primarily illegal immigrants living in Washington state. We're paying the whole bill there because by federal law, you can't give Medicaid resources, Medicaid benefits to people who are here illegally. This proposal doesn't fix that problem. It leaves the beneficiary pool diluted and is increasingly taxing a smaller and smaller universe of private health insurance to fund the dilution.
After debating 3 amendments, none of which were adopted, the House voted on the bill.
Has every member voted? Does any member wish to change their vote? The Speaker is about to lock the roll call machine. The Speaker has locked the roll call machine. The clerk will take the record.
Mr. Speaker, there are 56 yeas, 39 nays, 3 excused.
Having received a constitutional majority, substitute House Bill 1392 is declared passed.
The bill passed and heads next to the Senate for further review. As state lawmakers consider the future of hormone therapy, a House bill discussed at a Senate committee hearing underscores the larger conversation about balancing cost and access to care. House Bill 1971, which was heard by the Senate Health and Long-Term Care Committee Friday, seeks to increase access to prescription hormone therapy for patients of all ages by allowing them to receive a full 12-month supply of hormone therapy at once without frequent trips to the pharmacy. Under the bill, health plans will be required to reimburse patients 12-month refills starting next year. This includes a variety of medications used to treat conditions like menopause, gender dysphoria, infertility, and hormone imbalances. There are, however, some exceptions. For one, if the patient or their doctor prefers a smaller supply, or if the medication is a controlled substance, the full 12-month supply wouldn't be allowed. Democratic Representative Nicole Macri sponsored the bill.
This bill is not limited only to gender-affirming care, but that was my motivation for bringing it forward. Hormone therapy is used for multiple conditions, as you heard, infertility, menopause, thyroid conditions, cancer, etc.
Supporters say this is practical for patients, especially those with chronic conditions who have a hard time traveling to refill their prescriptions, and that it would increase access to life-changing medication and reduce interruptions in treatment. For people undergoing gender-affirming care or those managing chronic conditions, advocates say the bill will provide stability, ensuring they have the hormones they need without the risk of running out. Testifying in favor of the bill, LGBTQ community advocate Blake Burgess.
We live in deeply uncertain times. Every day, trans, two-spirit, and non-binary Americans wake up wondering if today is the day we will lose access to life-saving medical care. 81% of trans adults consider suicide. This means the risk of suicide is 7 times greater for a trans person. Some people use this data to scapegoat trans people, inferring that our transness is the reason for the suicide attempts. Rather, I argue that it is the social, medical, and legal persecution experienced by the community. Gender-affirming care saves lives.
No one publicly testified to oppose the bill, which also received support from the Office of Governor Bob Ferguson and the American Academy of Pediatrics. And that's a wrap for this episode of Legislative Review. Join us nightly at 8 and 11 to keep up with what's happening in the state legislature.